morning, I'm Julia Bache. I'm a GP and I've been here for many years, like 30. And so I do actually, well, having worked in the French system for that length of time, I think I know a little bit about it, the good things, the bad things. But on the whole, the French health system is an extremely good system, but it is sometimes a bit difficult to find your way around. You probably read about it. It's likes to say that many years ago it was classified as the best health system in the world. Unfortunately, it's not still the case, though it still does quite well. They were on the Euro Health Index, the most recent one. It came 11th out of 35. So as you can see, there's some very good things, but also some things that aren't quite so good about it. But at the same time, it is possible to find extremely good healthcare here. So first of all, I suppose the thing is, where do you find a doctor? There are the state-run hospitals. These are usually quite big and have many different departments in them. Smaller hospitals may just have a few departments, but you can always find specialists in these hospitals. Some hospitals are more specialised than others. For example, for neurological problems, Salpêtrière is extremely well known, world research going on there, but for skin problems, St. Louis, and so sometimes there is a hospital which is particularly good for a particular problem. Alongside that, you have the clinics. Clinics are usually private, but again, will have access to most of the specialities, and so you may want to see a doctor there. On the whole, they tend to be a bit more expensive, perhaps a bit more accessible though, which is obviously a benefit. And then you have also doctors who work in their practices, their own practices, their cabinets. And I'm sure as you walk around Paris, you have noticed, particularly in this area, that there are many plaques on outside doors of doctors working there. It always amazes me how many doctors are lurking behind these doors. And I think it's often a bit surprising for people when they come here. It's not super smart sort of consulting rooms, but very often, well, they're super smart in a different way. It's a typical French building, parquet floors, mouldings, and then a rather inappropriate looking desk and examination couch sitting there in the corner, often without a wash basin, which always worries me a little bit. And I think what surprises people here, that often doctors work single-handed. Coming from the UK, I'm very used to doctors working in groups, teamwork, and very often doctors are working more on their own. And so they sometimes they have a secretary, not always. Very often you find that it's the doctor themselves who answers the phone. So if you're actually looking for a doctor, it's often a good idea to start with a médecin généraliste, a general practitioner. But they would then be able to refer you, either deal with the problem themselves or refer you on to somebody who would be able to deal with it, an appropriate person. And if you're under the French health system, then you would actually have to register with a GP, a médecin traitant, and that would be the doctor who you would go to before to be referred. So excuse me, just take the jacket off. So anybody over the age of 16 has to register with a médecin traitant. And as I said, that would be the person who would then refer you on to a specialist. The advantage of that is, well, that you go and see the right person, but that also there is a thing in the French system called the parcours de soins, which means that you're following the right route. And it also affects the reimbursements which you get, and I'll speak about payment and reimbursement in a moment. But if you are referred by your médecin traitant, then you're reimbursed at 70%. If you go directly to the doctor, then you are only reimbursed at 30%. You can, however, go to certain doctors without going via your médecin traitant, and such as a gynecologist and ophthalmologist. It doesn't concern children, and so anyone under 16 can go to see a paediatrician or another a paediatric specialist. And also, you can, if you're under the age of 26, then you don't need to be referred to for a psychiatrist, but over the age of 26, you should go via your médecin traitant. So I think what concerns people a lot when they move here, what do I do if something happens, an emergency happens, what should I do? So urgent care, with an absolute emergency, then you call the SAMU. The SAMU is 15, or the European emergency number 112. What I'll do afterwards is I'll put together a list of numbers and addresses and things, and perhaps things that would be useful. So if there's anything else that you want me to add at the end, you need to tell me. And that is with the SAMU, you would speak to somebody. They actually do treat. They take a history and decide who is appropriate to send, really, because obviously sometimes you don't need a doctor, but sometimes you do. Obviously, any cardiac problem, you would need a doctor, and then they would decide exactly what level of care you would need immediately, and so they would send the appropriate thing. Having said that, the other people who you would call would be the pompiers. It always surprises people, certainly surprised me. But any accident or any fall of your child thinks at school, like mine did, then they call the pompier. And so the pompier are extremely well trained and often very, very nice, and will ensure that if a doctor is needed, they will call the doctor immediately. And the thing, if you do have to call an ambulance, then they will take you to the nearest hospital. You don't have any choice in which hospital you would go to. The next step would be going to an urgence. An urgence is an A&E, emergency room, and most big hospitals have an urgence, though only some have special ones for children, and those, now put these on the list. One is Necker Hospital, quite well known worldwide, but it's in the 15th, sort of near where the 15th, 6th and 7th will meet, near Duroc, and they will see children all hours of the day. It's often quite busy. Then you've also got Ambroise Paré, which is down, I think it's actually officially just in Boulogne, but the bottom is the 16th. Neuilly Hospital has a children's urgence, and then there's also Trousseau, which is in the 12th, and Robert Dubreuil in the 19th. So as you can see, there's not an enormous number who have specific paediatric urgence. Both the American hospital and the British hospital do not have an urgence for children. The British hospital used to, but unfortunately it's moved to me, so it's not there now. The next thing is maybe you need somebody to, you don't feel you need to go to a hospital, or you can't go to a hospital because you've got no child at home or whatever. And there are services, out of our services, who will visit at home. There's two, SOS Médecins and Urgence de Paris, and I'll put the numbers of them on the list for you. They will visit at home, but also SOS Médecins now has a 24 hours, but an out of hours anyhow, consultation service, which means they might ask you to go to them, but they're open at weekends and evenings as well, and so sometimes they see you or your child there. If you say it's for a child, then they will do their best to send somebody who is capable of dealing with children, basically. What is actually quite important is to be able to say your address and how you get into the building in French, because having spoken to the doctors who work with these services, they tell me that the most annoying things, you get to a building and there you are, there's a code and you can't get in, or which building is it? And so it's really important to be able to tell them exactly where to come. Ideally send someone downstairs, but that's not always possible. So talking a little bit about the payment and reimbursement. Under the French system, there is a thing that is a sort of medical convention, and each act, meaning a consultation, an X-ray, or physiotherapy consultation, whatever, each is given a code, and with that code there is a price that goes with it, and that is what is the basic conventionné price. And the reimbursement is based on this conventionné price. If you see a doctor in their practice, then you actually pay them directly. If you go to a hospital or in pharmacies, then you may not pay them absolutely directly. You may pay the extra bit that isn't been reimbursed if you have the carte vitale, which I shall talk about in a moment. The reimbursement that you get does depend on which sector the doctor works in. And so there are three sectors, 1, 2 and 3. 1 and 2 are work within the convention. Sector 3 is known as non-conventionné, outside the convention. And so with the conventionné sector 1 doctor, then they would only be able to charge the conventionné price, which for a GP, for a médecin généraliste, is €25. And you would be reimbursed at 70% of that from the Social Security. If you see a doctor in Sector 2, and most doctors work in Sector 2 in Paris, because as you can imagine, trying to run a practice on €25 a consultation, you doesn't really pay your rent. And so that the doctors tend to charge more. And then you are reimbursed at 70% of the conventionné price. And the advantage or disadvantage of that for doctors is that they pay more charges, so that's why it's a choice for doctors. Outside of that, there is the Sector 3, which is non-conventionné, and a lot of doctors who trained outside of France are actually working in this sector purely because their qualifications are not accepted to be at a level, even if they are, that allows them to work in the Sector 2. They said that they could work in Sector 1, but Sector 1 is very difficult to give people time, all the things that actually are rather important for consultations. And so with Sector 3, non-conventionné, then you get, the doctor can charge a price, a higher price, but they choose their price. But the reimbursement is really very small from the Social Security, hardly at all. Obviously with private insurance, they're not really affected by that. Usually private insurance is reimbursed on the cost of the consultation, and that's it, basically, percentage of that. So if you're part of the French system, then you apply for this thing called a carte vitale, which you've probably seen, one of these green cards, and that it offers a sort of through machine, like a top on hair machine. It is a direct contact with the Social Security. And so when you see a doctor, if they use the carte vitale system, then you are then the fact that you paid, as it were, goes directly to the Social Security. If they're not using that system, then they will issue that rather odd-looking brown form called a feuille de soins, and that is recognised, believe it or not, by all insurance companies, and they and then you have to send it to obviously either the Social Security or the or your private insurance. So it's all rather, I've done a bit of a whiz through that, and it's all rather complicated, so I'm sure if you have questions, please do ask me. Yeah, of course. Sorry, excuse me.
So, how do you choose your generalist?
Well, that's difficult as well, but...
but where do you go? They assign you one, or you need to pick up one?
You can choose, you see. obviously that if you want somebody English speaking, there are lists of English speaking doctors. I think that the school has a list, or the embassies do, things like that. And often talking to people, what somebody who's not too far from where you live, who sort of meets your needs. That's
And then you go to the social security and want to
no, you go to the doctor and the doctor gives you the form. Either the form, or actually that is something that can be done through the carte vitale. I have a direct link and I can immediately do it. Okay. So if you're going to a hospital or pharmacy, then you will only, if you've got a carte vitale, they will take that, and then you would only pay if you're going to be reimbursed at 70%. Then you would only pay it's known as a tiers payant, which is the 30% that isn't covered by the social security. The carte vitale is actually quite useful for other things as well. That if you need an avis de travail, so a certificate not to work, then it can be done directly. I must admit that part of the system works extremely well. Payments, I think, a little bit less well, as we're having to constantly chase them up. But on top of the social security insurance, people often have a complementary insurance, which is known as a mutuelle, and the point of that is to pay the extra bit, so the 30%. However, obviously, if a doctor's in sector 2 or 3, then it would be for them to pay a bit more. And all mutuals vary enormously as to how much they reimburse. For employers, it's actually compulsory to give all their employees a mutuelle. The trouble with that is that it's the employer who chooses, and so they don't always get much choice for the reimbursement. Some, for example, with children, some are very good at reimbursing. I don't think kids need glasses, orthodontists, all that sort of thing, and some won't reimburse at all. And so it is quite it's quite difficult, and you, as I said, you have no choice if it's through your work. But if you have a chronic disease, then you would be able to, or an expensive thing as well, then you would be able to, your médecin traitant would be able to apply for you to be registered as what's known as an ALD, an affection longue durée. And for example, if you have diabetes, if you have cancers are covered, and also fertility treatment is covered for a period of 2 years. All the treatment related to these conditions would be covered at 100% of the conventionné price. So again, if you see a doctor who charges more, then there would still be a little bit for you, but any hospital treatment, which very often a chronic disease is followed more in a hospital, would be covered at 100%. Unfortunately, at the moment, long COVID does not come into this, which is something which is causing quite a lot of concern for a lot of people. And as I said, in order to get this, then your doctor has to complete a thing called a protocole de soins, which outlines the condition. Also, any medication that you would need would be covered, and any other specialists that you need to see. For example, some chronic problems need frequent physiotherapy, and then that would be covered as well. Vaccinations. All countries have a slightly different vaccination schedule, and each country thinks they're right, but anyhow. As you perhaps know, in France there are 11 compulsory vaccinations for children to be given within the first 2 years, I think, before they go to school. They are the sort of fairly standard ones. So at the beginning, diphtheria, tetanus, polio, whooping cough, Haemophilus B, hepatitis B, and they have another pneumococcal, which are given at 2, 4 and 11 months. Then there is the meningitis C, given at 5 months and 12 months, and then the MMR, given at 12 months and a booster at 14 to 16 months. They have just added to the schedule the meningococcal B, which has been given in the UK for some time. I don't know about other countries, and that is also then added in at 3, 5 and 12 months. They think you're going to give 3 injections on one day, which I must admit I'm not going to, but I will spread it out slightly. The flu vaccination is available from mid-October. The last couple of years it's been a bit staggered as to what age group has it when, so it's more sort of people at risk at first and then general population a bit later, so it probably won't be until November, which is fine because it then ensures that you're covered at the end of the season. I know in some countries they focus on giving children the flu vaccination. Here it's not quite so, they're not quite so keen on giving children the flu vaccination, but it is available for children and children can be vaccinated. I know in some countries again it's very much encouraged. So I suppose any talk about health wouldn't be complete at the moment if we didn't talk a bit about COVID. Obviously, I don't have to tell you, we've lived through 2 extraordinary years and people have had to adapt to very changing circumstances. I must admit I've been so impressed with the schools as to how quickly they have adapted. You know, the lessons have continued and children's education has continued despite having a weekend to change exactly how it's done. So I think they've been absolutely amazing. That the very good news is that, as you perhaps saw in the papers this week, that the WHO have said that the end is in sight, which I think everybody breathing a sigh of relief, we hope they're right. Because I must admit, I feel that in October, November, we're going to see more cases, though we already are seeing a few more, well, increase in cases, quite significant increase in cases, as people all get together again after the holidays. But the good news is that, as yet, the hospital admissions are not really increasing. And so the virus is doing exactly what the viruses like to do, which is to mutate into a much more transmissible form that causes certainly less mortality, because obviously it wants to survive. And so we hope that it's beginning to sort of burning itself out to a certain extent. Anyhow, the type that we're seeing in France at the moment is predominantly the Omicron BA5, I think we're at now. The vaccine here is given to everybody, is offered to everybody from the age of 5. For children 5 to 11, they have 2 doses, 3 weeks apart. And it's the Pfizer pediatric one, which is actually a third of the dose of that given to adults. If a child has already had COVID, then they just have 1 dose. And if they get COVID more than 15 days after their first vaccination, then they don't have a second vaccination. At the age of 12 to 17, then they have the adult Pfizer. For younger children, it has to be given by a doctor, so doctors who are giving it, or in a clinic. For anybody over the age of 12, it can also be given in pharmacies. Quite a lot of pharmacies do give the vaccination and have them available. For 12 to 17-year-olds, they have a second dose 3 to 7 weeks later, so it's a little bit, that can be a bit later. And they also have a booster 6 months after the first 2 are completed. Obviously,
then after the 3 weeks, when they should have the
I'm sorry, for which age group? Yeah. 17. Yeah, they would have 1 dose. 3 to 7 weeks later, they can have the second dose.
Oh,
Okay, and then they have the booster 6 months after the second dose. Okay. Once they get to over the age of 18, it can be 3 months, but in the younger ones, they need a longer time. Then obviously for children, you have to have parental consent, and that a child under the age of 12, the parent has to actually be present for the vaccination up until 16, 12 to 16, as long as they've got parental consent, then it can be given in a clinic, or I don't know, sometimes schools arranging whatever.
Questions?
Yeah.
So So vaccination for pediatrics such as kindergarten or low grade, you mean that it is not mandatory, it's not compulsory yet, so parents do not want to
No, it's
the
not
kids to be
mandatory.
vaccinated.
It's not mandatory.
Because of that, I'm worried about the safety issues still exist of the COVID vaccination to pediatrics.
Mm. Okay, I mean, it's not compulsory. Then obviously for adults, that at the moment that the booster is being offered, the booster meaning the third injection, is being offered, and that unless they're at risk, then they can actually have a second booster as well, if that makes sense. Okay. And they,
How it starts with the adults? The first shot, then the second one?
yes.
After 3 weeks on?
3 weeks as well, I think. Long time since I've given it, yes. Yeah.
And then the third one?
The third one, then you can, as long as it's 3 months for an adult over 18, it could be 3 months, 3 to 6 months. Yeah. And if you actually have COVID, that counts as a vaccine. Okay, unless, yes, exactly.
Adding to that, after you've had COVID,
Yeah.
how long is it considered vaccinated, the COVID itself?
3 to 6 months.
Okay, so if you had it last winter, you would get a booster for the.
Exactly, yeah. 3 months is the minimum, and after 6 months they're wondering about whether you are protected or not. The rules about isolation. Sorry, is that what you say in English? I think so. Couldn't quite get it. Is this that if you test positive, then you must self-isolate for 7 days. Unless if you haven't been vaccinated at all, then you actually have to self-isolate for 10 days. But if you've been vaccinated at day 5, you can actually do another test again. If your test is negative, then you can slowly come out again. But it is recommended that you wear a mask for the week after, as long as you've got symptoms, because obviously a lot of people still have the congestion for a bit of time or coughing afterwards. So I think that covers quite a bit about COVID. Obviously, if you have any questions, please do.
Sorry, for the fourth the booster,
Yeah.
in France at the moment, I understand that you have to be over 60 to get it.
Over 60, or if you're at risk, and that means if you have a certain illness, if you have immunodepressed, or if you're living with somebody at risk, or pregnancy as well is considered at risk.
Are you aware when it will be available for people under the age of 60?
No, I get the news usually from France Info, and they do a sort of, and then about sort of 2 hours later, I get a thing from the Direction Générale de Santé. But there actually is 1 or 2 sites. Whenever I look things up, the site that comes up, which is extraordinarily useful and surprising, is a thing called Le Journal des Femmes, and they have a santé part. And I must admit, they're absolutely up on all their articles, and they've often been updated within the last few days, which is a lot better than the ANNALY, the Social Security site. So, well, worth looking at.
Sorry, I have a question.
Yeah.
So are there any rules here when you should get tested? I mean, the symptoms are quite big variety that you could often feel. Yeah.
There's no actual rules, but I think there's probably what I would say is that people test often immediately, and so it's negative. But I've seen a lot of people where the test has become positive on about day 3, even 4. So I do often recommend people to do a test again. But all the rules, I can't remember when they did. It was before the summer. As you can see, masks and things were not. It's not obligatory, compulsory any longer.
Thank you. I have a question about the vaccination. If you do want to get vaccinated for the flu, do you have to schedule an appointment with a doctor, or is it also given at
No, actually pharmacists can give it to adults.
Oh, okay.
Not to children, but they can to adults.
For, so for the
Yeah.
children, you have to.
Yes, sorry, I didn't say about the flu vaccination. You don't need a prescription for flu vaccination. It is, it's not reimbursed anyhow, and it costs all of about €7, I think. So it's not expensive at all, and that can be given directly in a pharmacy. Yeah, it's a very good idea to get to know your local pharmacy and the pharmacist, and then if you're on regular medication, then they'll, if by any chance you've just forgotten to get your repeat prescription or something, they'll often help you out. And they're helpful if you've got children. They will help when to give you the right things. Okay. Yes.
The flu vaccine for children, is that a needle, do you know, or is it a
Yes, the needle one. They don't do the nasal one.
Okay.
So, yeah. COVID tests can be done there are self-tests that you can buy, but obviously that doesn't give you an official result. The pharmacy can do a test, and they can do both the antigen and the PCR, and labs can do them as well. So again, I think it's probably since the pharmacy they're quite used to doing them now. Because I don't know if it matters now, but there was a time when people were self-testing, which is great because that it's responsible. But the trouble is, it didn't give them an official result with this QR code that was so important. And so to justify that you've had COVID, particularly if wanting a vaccination, well, it's often a good idea to get a formal test done. And so that you've got this, it goes through the system. It also can set off, I think something is sent also to the social security, so if you're working, it makes it possible for you to have your arrêt de travail as well, time off work. Okay, so, but it has actually been, it was quite well organised actually. It's been such a complicated time. I think they've adapted surprisingly well. So moving on just generally to prescriptions, that obviously doctors write prescriptions, but it always often surprises people that even if you're on long-term medication, the doctor will give you a prescription for 3, 6 months, whatever. The pharmacy will only dispense 1 month at a time. There are 1 or 2 exceptions to this, where some of the blood pressure medications come in boxes of 90. So I try to specify 3 months repeated, rather than saying 1 month repeated, because then you'll just get 30 at a time and you have to go back every month. So that the prescription will often have these repeats on it, so you need to keep that piece of paper and actually keep taking it back, and the pharmacist will stamp it, and if it's a 6 month repeat, when they've got their 6 stamps, they won't do you anymore. And after that, then you will need to see your doctor again. On the whole, doctors don't do repeat prescriptions by phoning, writing, or whatever. But what I tend to do is I sort of give a prescription until it's time to reassess or check again, or what's considered right for the patient, good medicine generally. Okay. And you also need prescriptions for to see a physiotherapist, or anything that's reimbursed. You need a prescription. So to see a physiotherapist, often speech therapy for children, you need a prescription from your doctor. Often for speech therapy, it's first of all a BLON assessment, and then sessions. And so often you do need that. For physiotherapy, sometimes it's until you're better, but sometimes it's a number of sessions, so then again you have to get a repeat as well. With physiotherapy, again, it's reimbursed. There's a set price, and it's reimbursed the same way as with doctors. For osteopaths and chiropractors, and I'm sure there's many other on the list who are not with a little reimbursement. I say that because actually a lot of mutuals now will reimburse a certain number of sessions of osteopathy. For other things, no. But if you're not going to get reimbursement, then you don't need a prescription. Sometimes it's a good idea to talk to your doctor anyhow, but on the whole, you don't need a prescription. I was going to say that, I can't remember. So The only other thing is that there are various screening programs that are national screening programs. They tend to start, most of them start sort of later on in life, as it were. At the age of 50, that there is a national screening program for cancer of the colon, and it is a immunochemical test for blood in the stool, and it's quite effective. And I've had 1 or 2 patients recently picked up on that, so that's actually extremely effective, and that's done every 2 years. And also the national program for breast screening starts at 50, though I know that a lot of doctors are prescribing mammograms sooner than that as well, obviously, particularly if there's family history. It's terribly important. Things are started sooner. And there's also a national program for cervical cancer screening, the smear tests. So I think that covers quite a lot of it, and I don't know if you've got any sort of questions now that you'd like to ask, or things I haven't covered. Yes.
I'm a contact lens wearer, so I need to get an annual health check. How do I go about organising that?
Oh yes, ophthalmologists seem to do things like eye tests. Basically, you see an ophthalmologist. I don't know where you're from. I'm perhaps used to seeing them, going on to Boots if you're in the UK and getting it tested. But on the whole, you would see an ophthalmologist, and they would do all the tests necessary. And then they would prescribe the lenses as well.
So can you just walk into one of these? Is it like within some of these stores you see selling glasses? Are they within there? Or
You can have a test there, but if you then need glasses, then you actually have to have you can have a prescription from your GP. So they can do that, but then you need a prescription for the actual. Yes, you can. I can do lenses, yes, but then you need a prescription. Because again, you're going to get some reimbursement. If you're paying for yourself, it probably doesn't matter whether you get reimbursement, then you need that. A bit of overwork, really, but still. Other things, yes.
Vaccinations for children, so
Yeah.
the cervical cancer
Yeah.
in the UK, is that available here?
Yes, it is available here. It's not compulsory, but it's really, I would say, very much advised. It is offered to children between the age of 10 and 13. It's 10 and 23, excuse me. And it's offered to boys and girls now. But if it's done before the age of 15, then it's just 2 vaccinations. After that, it's 3 vaccinations. And it's over a period of 6 months. It's 1 and then another 6 months later, or for an older child, one another one 2 months later, and then 1 at 6 months. But certainly it is recommended. The figures since we've started giving it for cervical cancer have really reduced, and they even think that if you get an adequate immunisation uptake, that the disease will be a disease of the past by 2050, which is fantastic news and amazing science, really.
I didn't quite hear that.
The GP, yeah. With vaccinations, it sometimes surprises people, but I don't keep them in my fridge, basically. But the doctor gives the prescription. You then go to the pharmacy and get them, and then bring them into the doctor who would give them. So that's what happens. And often I suggest that you tell this pharmacy you're going to have got your appointment at a certain time, and then they will keep it in their fridge, which is the right temperature. I always worry about vaccinations being domestic fridges, perhaps because I worry about my own, but anyhow. But that works quite well, and then you just bring them in. They can be out of the fridge for 4 hours without any problem, so it's not just something immediate, but obviously it is important that they are kept at the right temperature. Yeah. I think that it depends a little bit what it is, but on the whole, no, because they are responsible for that they have to justify their dispensing, and so they have to be able to show prescriptions that pharmacies are checked on quite regularly. and so therefore they're pretty careful about how these things are kept. So they keep a copy of your prescription usually.
Right, so you're saying a prescription written by a physician in the US, they won't fill it?
It's very unlikely, yeah. They might help you if you're really stuck. You're an asthmatic and you have a Ventolin inhaler, they're likely to help you. But if it was something for a long-term medication, certainly anything where there's any concern about it, any psychiatric medication, no. One of the things that I see is that that there are quite a lot of children who are on the treatments for ADHD, and that here, well, first of all, there are only two available. There's Ritalin and there's Concerta. I think Adderall doesn't exist here. And both are considered control drugs. Control drugs mean they can only be prescribed for 28 days at a time, and that the repeat prescription, you're officially meant to see a doctor, and it can only be written from a couple of days before, and once it's been given, then it has a date on it, then it has to be used within a few days of that date. So it's actually extremely difficult, and so I know that sometimes children on these medications come across with a year's supply, and they rather expect to have another year's supply. No, it doesn't work like that, I'm afraid. And the first prescription also has to come from either a paediatrician or a psychiatrist. A generalist can then do the repeat prescriptions, but they can, once a year, you have to see a psychiatrist or a paediatrician for these medications. Yeah.
So, so the pharmacist could prescribe
They can't prescribe, because they're not prescribing, the doctor is prescribing. They can supply you with one if you're really stuck, but they would say, listen, you really need to get a prescription from your doctor. They might ask you to see your doctor, if it's say a Saturday. They might say, will you see your doctor on Monday and get a prescription for this? So the answer is they will not accept a prescription from the US.
And then for the clinics, are they visible? Like if you were walking by and you see that that's a clinic? Or, you know, like the pharmacy has those green cards,
you do?
where you're walking around, you're able to see a clinic.
I think they usually advertise themselves quite well, don't they? So, yeah, I think so. I mean, it always surprises me that, there are often, in a street, as it were. I mean, it's different. I mean, clinics, yes, you can probably see because they've got a lot of people going in and out and whatever. And if they're bigger, if they're small, there is actually quite opposite where I live. There's actually a medical group there. And I was invited to a meeting there. I was surprised to find that I looked out at them every day and I hadn't actually seen them. So, some things are just these sort of big doors that you have in Paris, and there's just a little plaque outside, so you don't always know quite what goes on behind. Yeah. Oh, I was going to, sorry. Yes, I'm sorry. Yeah, I'm sorry. I did actually make a thing about making appointments, so I'm sorry.
Most doctors are gonna work out of their own office, so you will have to make an appointment. It's not
Sorry.
based on the.
You can't just walk in.
Exactly, yes, exactly. I'm sorry, so I missed out a bit about making an appointment. But making an appointment, yes. You may have to call the doctor directly, and as I said, sometimes it'll be the doctor who answers, sometimes their secretary, sometimes the secretary, a remote secretary, meaning there are centres who are working for doctors. But also now you're possible to make appointments online. But one of the online services is called Dr. Live, and in fact, there were several more, but Dr. Liv seems to have taken them over and seem to have the market now. And so I didn't sign up with them because I thought no one would be able to spell Dr. Liv, but of course now it's become part of everyone's vocabulary.
If you have these on page 43 onwards, on page 43, the list of pharmacies, there's the spelling of Dr. Liv, and there's also Dr. Julia Bache's contacts. And a lot of recommended doctors that we as a community have used, and all of these doctors speak English. Other than last week, the emergency numbers that Dr. Bache mentioned, they're all here. The numbers are different from when you call from a landline, the numbers are different from when you call from a mobile. So it's all listed here. The fire, the pompiers, the firemen, the SAMU, the ambulance. So this is an essential must-have. I hope everyone has a copy. We all have ours at home. So if you don't, please see me another video.
So with Dr. Liv, it's actually it is a very good system, and in fact, they organised all the COVID vaccination appointments. That it was one of the only one. There were only 2 or 3 ways of actually making an appointment, and Dr. Liv was one of them. And what it is it's an online booking system. What you do is you register online with them, so you have your own account, and then you can make an appointment. And they are quite good. They send you reminders. And you can just, it means also you can make appointments out of hours when you need to. Sorry, you can make the appointment out of hours, as it were. And it does seem to work quite well. Also, if you need an X-ray or something to get done, then you can look up radiologists and see who's available in your area when the next appointment is. I do find it quite useful for looking for other doctors. Not all doctors have signed up to it for all sorts of reasons, partly because they're quite expensive. But on a lot of doctors are part of it, and I think it certainly is quite helpful for finding a doctor. I think the only thing is that if a doctor is available soon, it doesn't always mean they're the best doctor, and so I think that can be a bit of a problem. Actually, people find themselves making appointments with doctors that doesn't really work out.
With the Dr. Liv online kind of system then, how does that work alongside the Carte Vitale and the 1, 2, 3, kind of how, does it specify kind of what grade they are, or?
Yeah, usually it says that it usually they say the price of a consultation, they say does this doctor accept Carte Vitale or not, which is not necessarily which sector they work in, because that a lot of doctors don't in sector 2, as it were, but I think it usually says the sector that they're in, but obviously if the price is a lot higher, then you know that they're sector 2, and on the whole, if people are sector 3, then it says that, because it says that you're not reimbursed so much.
Thank you.
The other thing about Dr. Liv is a system that part of it that I use, which is that you can also have video consultations. Obviously that during confinement, this was, well, it was the only way I worked for 2 months. And this, obviously that if you're in for COVID patients in isolation, but also just generally for a lot of things, then a video appointment works very well. I find it a lot better than telephone call. I just think seeing somebody, you can see a bit really what's going on. But if you, for example, for a repeat prescription for blood pressure, as long as you're checking your own blood pressure yourself, it's important that you keep records, but you have to be seen at some stage, have your heart listened to, whatever. But sometimes for certain repeat prescriptions, it can be extremely useful. And that again, it's done. There are 1 or 2 systems. I think there's one called Quare as well. But I use Dr. Liv, and when you go onto the site, it asks if you want to have the appointment in the cabinet, and you go to the practice, or online, and so you can make a choice for that.
You know the list of hospitals who have the pediatric registry?
Yeah, I can do that. I'll write it up afterwards. I think the ones that I gave you, the Trousseau, Robert Dupre, Necker, Lee, and one more, Ambrose Pappy. You know, down in there. They're very good actually, Ambrose Pappy. If you're 16th, I think it's probably a good place to go to. Yeah.
The national screening programs that you mentioned, how do you go about doing any of those? Is it through your GP that you have to get an appointment or prescription for it, or do you go to GP?
If you're registered with the Social Security, then it comes through them.
And if you're not registered?
Then you miss out of it, so you have to do things through your GP, yeah. Then it's all done, it's done privately basically. But I'm afraid you don't get the reminders and things like that. But it automatically happens that people, once they get to the age of 50, are all surprised they start receiving these letters. So.